Thank you very much for having me here. So my name is Artemis. I'm a first-year PhD student at University of Zurich. I'm currently visiting at Stanford, so it's a much longer flight to come here. And today I'm going to present potentially my job market paper. The title is Environmental and Health Effects of World's Largest Afforestation Program. This is joint work with Ruixue Li from Columbia. So just to briefly motivate my study, so desertification is quite a big challenge globally. So you can see from the first map here, about like 40% of the lands globally are subject to the risk of being dry lands. So one direct consequence of desertification is dust storms. So, and this is more relevant for downwind locations in the sense that usually nobody lives in the middle of the desert. But when the strong monsoon, like strong wind happens, they can bring the sand over long distance, and that's going to bring large health externalities for locations far away from where the dust storms originate. So here is like a picture from 2021 from the central business area of Beijing, and you can see this is like a how it feels like when you're in a dust storm. So to mitigate the problem of desertification, and one commonly adopted policy tool is afforestation. Right? But it's still quite unclear because planting trees in dry areas can be very costly, and we don't exactly know how cost-effective this policy could be. So this is the purpose of our work here. We want to estimate the cost-effectiveness of afforestation. Okay. So we're going to look at a very particular policy setting in China. So we want to evaluate the effects of this afforestation program called Three North Shelter Belt. And you probably heard the word the Green Great Wall, which is this program. So this is a government-funded program, and so far this is the largest afforestation initiative in the world. It spanned a very long time from 1978 until 2050, so it's still ongoing. So the target of the program is to restore like this amount of vegetation that's basically equivalent to the whole area of Germany. Geographically, you can see this is the green area here is the policy region, and we care about the health outcomes at these red dots, which are our sampling cities. So our research question is pretty straightforward at this point. So we want to estimate the health benefits from this afforestation program, and then we want to compare with the cost of the program.
Sorry, can I ask you one thing?
Yes.
I guess you're focusing on these health benefits for all sorts of reasons. Mm-hmm. But I can understand or can imagine that this policy has a wide array of other benefits, right? So
exactly.
How are you going to account this in the cost effectiveness, cost benefit analysis?
So far, we are only capturing health effects, but later on, we definitely want to like expand to other things like carbon storage and
it could be maybe, right? The biodiversity. Yeah. I mean, one can come up with a very long list of benefits of that, right?
Yeah.
So it's really focused on the sort of health versus the whole overall cost of implementing it, what you're going to be after in your project.
Yeah, that's a possible extension of our projects to expand to other types of benefits. But for now, we want to focus on health because it's the most direct effect that you can imagine from like reducing air pollution. Yeah, and also it's pretty easy to quantify. Some other benefits, it's more difficult to quantify. That's also another reason. But yeah, for now, we just want to keep the focus. Yes.
Feel free to postpone this, you're going to come to it. But how far should we think of this as this is a binary policy that you do or don't do and conditional on doing it? It has to be in this location. versus there are other dimensions of choice here that I don't know how these red dots, you're presumably going to tell us about how these red dots are selected, but you could have done this in less arid regions, but that are sort of still between the desert and the populated areas. Are there dimensions of choice that one could think about optimizing over other than just this implementation was cost effective or not?
Yeah, that's a good question. That's another extension we want to do in the future. So for now, this is only a policy evaluation. So we're just evaluating whatever that has been done already. But in the future, we're thinking about doing some kind of Monte Carlo simulation to get a sense of what the optimal location would be for planting the trees. Once we can set up a total cap of the cost, or just set up the total cap of the area. So there are multiple ways to do that. Yeah.
I just ask, building on the first question, what was the government's motivation? Was it very specifically about air pollution, or was it a broader motivation?
Yeah, so to reduce dust emissions is definitely very important dimension. So the government documentations mentioned this like many times, but there are also other considerations like so like this area in Xinjiang province and this area in Inner Mongolia, these are basically the desert area, and around these regions, those are like really poor areas. And once the desert start to expand, also the living conditions around these areas also get worse and worse. So another potential benefit is to boost like local economic output just by making the natural conditions better in the local areas. So yeah.
Sure, just to clarify, so the sampling cities are where you measure health benefits.
Exactly.
Are you concerned about other policies like renewables? They also build a lot of renewables areas.
Renewables?
Like solar panels.
Okay.
Industrial solar.
So in our like regressions, we're gonna add city fixed effects for sure. So that should be able to capture the city level heterogeneity there.
I mean, I guess it depends on when are you looking at variation over time, or like, are you looking at cross-sectional comparisons? Because I would imagine.
No, it's a panel. Yeah, but we can talk later. Yeah, but the reason why.
Sorry, was the forest they're growing originally there the same type of forest that was originally there, or was it kind of a new set of species? Like, was this originally a forested area that got cut down and then they're trying to replace the same species, or is it just new forest with different species?
Yeah, so there are very complex historical reasons why the desert was expanding. So I think, so in short, it's not exactly as the same as reforestation. So at the beginning of the project, the government actually made a lot of mistakes of planting the wrong trees, and they didn't really survive. So that's why I call this afforestation instead of reforestation here. But the reforestation is also like part of the whole project, but it's not exactly the same. All right, I'll just go quickly through the literature. So there's some similar analysis on small scale afforestation initiatives, but I'm arguing here like, we are estimating essentially the largest afforestation project in the world, and they can be quite different, fundamentally different from the small projects by having larger spatial spillovers. And yeah, in the public good literature, we have this threshold theory, which means you have to surpass some level of threshold in the public good in order to have a positive impact. Yeah, and that also relates to the second point of this potential nonlinearity in marginal returns to public goods. And because we have this long time span, so we can potentially test if this is right or wrong. And the last one is, yeah, we have a huge literature on health damage from spatial spillovers. But here we are kind of study afforestation as a policy intervention in mitigating these health damages. And our setting is kind of focused more on dust instead of industrial emissions. And here I'm going to talk about the data sources that we're using. So our mean outcome variable here is PM 2.5. This is reconstructed by some scholars, and because the historical period, we don't really have good observational data, so they use machine learning to back up the previous the historical period. We don't really have good data. Yeah. So if you just see this graph here, it's pretty clear. So if we compare the sampling cities just by looking at whether they are inside of the policy region or outside of policy region. So before the policy started, the trend is pretty similar between these two groups. But afterwards, you can see outside of the inside policy region, the level is much lower. Okay. I mean, this is not causal, but this is just like anecdotal evidence. And to measure vegetation, we're mainly using this land use data. Also, it's reconstructed by some scientists out there. So we have this global level data at 0.01 resolution. So we have 14 different types of land use classes, and we're mostly interested in like these ones are forest, different types of forest, and grass and shrubland and pasture are also considered here. Because for our case, the forests are really the arbor trees, but the ground vegetation here is actually also quite important because those are more suitable to grow in like arid areas. Okay. And so this slide is talking about how we construct our vegetation measures. I'll just go very quickly. So we aggregate everything to the same level as our outcome variable, the PM data that we have. So from so forest and ground vegetation, which is pretty simple, it's the aggregate of the corresponding types. But then we also construct this weighted vegetation measure, where we just simply count forests as 100% and other types at 50%. Yes.
Could you go back 2 slides?
2 slides?
One more. What's the drop in the later periods?
Sorry?
One slide. Yeah, what's the drop in the later periods after 2010?
What?
Huge drop in emissions in after 2010 in both.
Okay, after 2013. So this is a national level drop in air pollution. This is not really relevant for our project, but this is a well documented trend because the Chinese government started something called War on Pollution in 2013, and then the national level PM just dropped very significantly. Yeah, I was here.
Sorry, I had a question.
Yeah.
What's the role of vegetation in your story? Like, is it to bind the soil? Is it to stop the flow of the wind? What exactly is the vegetation doing?
Yeah, there are basically 2 functions that you just described. So the one thing is the root of the plant can fix the sand, fix the land, and then, you know, there's no sand you can blow away. And also you can stop the desert from expanding. And the other one is to block the wind. And those are more relevant for those high trees. Yeah.
Sorry, a little bit on the public finance. Was this funded by the central government but implemented by sub-national government?
Yes.
Regional, provincial, or?
Yeah, in short, yes. So the central government account for like 99% of the funding basically. And then they basically you give out the tasks for local governments and they actually implement.
Are you concerned about like differences in effectiveness of implementation driving the differences in vegetation that you observe? Like it's not really the amount of money they spend, it's more about how well they were planting the trees across regions that drive variation in your vegetation.
Yeah, there could be regional differences in like how vegetation grows, but we are kind of like for now, we are just estimating the average effect, right? So it doesn't matter that much. So we also have some alternative measures based on the normalized difference vegetation index. I don't have enough time. Let's just skip that. Okay, and we also have some administrative data. So the mortality data are from DSP, but we don't really have this yet. We will have it soon, hopefully. I'm in the stage of making the contracts with the data agency. Yeah. Okay. But anyway, we should have city level mortality records by causes. So by causes, in that way, we can actually identify the disease that's relevant for air pollution. Okay, estimation strategy. This is the most important part. So the end goal of our project is to back up the effect of like 1 additional square kilometer of forest on house gains. And our main strategy here is to use IB framework. So essentially, the marginal benefit we are trying to estimate here come from these parameters. So alpha captures the reduction rate, and tau is the dose response, and then we multiply with the value of statistical life. So you can see in the end, if you cross out all the units here, then you get this marginal benefit as a dollar amount per square kilometer of vegetation. Yeah.
So perhaps I missed this part, but when we say additional kilometers squared, how certainly can we identify which types of vegetation growth is due to the program as opposed to natural growth?
I will come back to this.
Okay.
Yeah. Yeah. So yeah, this is our main equations here. So the first stage is essentially two fixed facts. So our mean variable of interest here is this guy AIT, which is a weighted measure of policy-induced vegetation at city eyes upwind locations. So policy-induced, we have a separate step of estimating this, which is your question, right? And I'll come back to this. And here, the upwind locations, so this is captured by high split, which is atmospheric model. I don't know, I guess many of you have heard of it. So yeah, so basically this W guy here, yeah. So basically JT prime, so J is an upwind location of I, and T prime is a backward time of T. And we're capturing all the wind exposure from backing time upwind locations to location I at time T. So this this weight is capturing the share of air from location J at backward time T prime on downwind city I at time T. Okay. And then we multiply this together with the vegetation measure at the upwind location, then we back up this AIT at the downwind location. Yes.
Just out of curiosity, how do you pin down downwind cities? As far as you know, the direction of the wind changes over seasons, right?
So the downwind cities are just the red dots you saw on the previous slides. So those are just, we selected those samples. Okay. Yeah, so, sorry. So I here is out of our own choice. T is also out of our own choice, depending on how you want to sample the whole thing. Yeah, but J and T prime are outputs from this atmospheric model. Okay. And second stage should be pretty clear. So here, the YIT would be the number of deaths from relevant diseases, and that would be the reduced form. And so the delta here will just be the alpha times tau. We don't really care that much about the second stage in our case, but we think alpha could be a very interesting parameter to look at, and also delta here. Yeah, so yeah, here, this is talking about the backward high split. So basically the model will give us this guy CJT prime IT, and we normalize that to add up to 1 for each city day pair. So in that case, you know the relevant share of how much upwind location at a backward time t has on 1 observed unit of air mass at a downwind city I at t. Okay, is that clear to everyone? Okay, cool. And here I want to show you some pretty cool graphs. So an important source of our exogeneity just come from this day-to-day variation in wind. So you can see I pick like 3 consecutive days, and in at the same location, you just look at 1 day apart, you can see the wind blows like, totally differently. So this is a very important source of exogeneity from our identification strategy. And also from like government documentations, we argue that the decisions that governments make on where I'm gonna plant trees are very unlikely to be relevant to downwind conditions. It's mostly relevant for the upwind locations.
Can I ask you one thing? This is super cool, but ultimately this policy you discussed, it's something that is targeted to last 72 years or something, right? But regardless, is this daily variation that you're showing here, would that really matter for health outcomes? In a sense, if there was only 1 day, you know, that I was unlucky to be exposed, should you see some effects, you know, in health outcomes?
Yeah, actually it does. And for like dust storm, it's like a very high concentration of PM in a very short time. So usually the dust storms wouldn't last for more than 3 days.
So it's not something cumulative that over years is going to compound on health, but it's more this sort of extreme type of things you have.
Yeah, exactly. So this is almost, so dust storms almost like a natural disaster in this case. Yeah.
Yes, so got a bit confused. So you're saying the wind doesn't affect whether a tree gets swept down or goes? Like, what is the wind exogenous for? Because, you know, you have a sapling and then there's a strong wind that can destroy the tree as well.
Ah, okay. We don't really think about how the wind can destroy the trees. Okay, well, that's an interesting dimension. But basically, what I'm trying to argue here is, so let's think about, so today the wind blows from an area where you have a lot of trees, versus tomorrow, the same area, but the wind blowing from an area where you don't have trees. So by comparing these two cases.
I'm trying to understand what you're taking exogenous. You're saying, I understand you're saying that the way the wind is blowing, whether it hits a lot of trees or doesn't hit a lot of trees is different, is exogenous. But what defines where there are a lot of trees and where there are not a lot of trees?
Sorry, I don't quite get it.
Like, what defines the variation? I think someone asked this earlier also. What defines the variation in tree cover?
The variation of the trees come from the land use data. So over time, it should be increasing.
No, I understand that there is variation in the data, but what is the exogenous variation or the quasi-exogenous variation in that? Like, you know, suppose rich areas grow lots of trees, and then the wind blowing through them has less effect on mortality, but in rich areas, mortality is also lower for lots of other reasons. That's the kind of thing you want to exclude.
Okay, I see. So, I mean, I think that's also relevant for like industrial pollution in on the city level. But in the end, we're going to include like the city by year.
I think that's
fixed effects.
If you're going to have city by year fixed effects, then how will you identify mortality? What's the variation left in mortality?
But the mortality is also daily level.
You're probably not going. I mean, I guess you haven't got the data yet. You can see, but you know, you're probably not going to have a lot of power to identify daily effects. You need to be able to aggregate it up a bit.
Okay. Yeah, we can talk later. Maybe I misunderstand something here. So I'll just go on then. Yeah, so we also use this staggered div strategy to isolate the policy effect from like natural factors that can affect vegetation dynamics, because we have this staggered treatment feature of this policy phase out here. So this is just pretty standard CS diff and diff, and we so here the outcome variable is the vegetation share in year S, if it's treated. Yeah, and then we use this estimates that we estimate from the staggered diff and diff, the group time treatment effects to back up the policy-induced vegetation area. So hopefully, thank you. Yeah. So in this way, we can say that the vegetation area that we're capturing are actually from the policy instead of other conditions. Okay. Yeah, so this is just a recap. So this is the causal chain of our entire story. So the government planted trees in the policy regions, and that caused vegetation to grow. And the vegetation grow reduce the pollution, which in turn reduce the mortality. So here I show some preliminary results we have so far. So this is from the staggered diff and diff. So you can see, so there's some weird things happening before year 0, but we think there's probably some kind of anticipation effect here. Also, there's a big drop in year 19, and I think this is because of a data issue that we have in our comparison region. So we construct the comparison region as the 300-kilometer buffer around the policy region. And that basically covered a lot of area in Mongolia. And Mongolia had like a policy, a reporting rule change in 1996. And then the vegetation area in Mongolia in that year just increased quite a lot. So I think that's pretty much the reason why we're seeing this big drop here. But we will think more about how to deal with this later on.
Is the war on pollution in this, I mean, in some sense, wouldn't you expect to see that the policy binds less when, if the main imperative is the local air pollution motive, that once this is tackled through industrial pollution mandates and so on, that there's less of an imperative to.
I see. This has nothing to do with pollution. This is just vegetation. So the
what I mean is, if the war on air pollution is, if the vegetation program was designed predominantly to tackle the air pollution problem, and then you've got this huge secular decline in air pollution from other sources, that there would be less.
Okay.
This would be less binding. That there'd be less enforcement. Maybe not. Maybe there are other reasons. Maybe it by this point was targeting biodiversity or something else. But I just wonder if the war on air pollution is in here, or if you'd expect to see a signal.
Yeah, I think. Yeah, so for now we're just estimating the average effect for the whole period. So that only covers like 6. So the only 6 years of this big drop. Yeah, but we will think more about this. Yeah, for sure. Thank you. Yeah, but this graph is just for vegetation. This has nothing to do with pollution. And this is our, sorry. This is just our preliminary result on the prefix facts. So we got a pretty strong effect from vegetation on pollution drop. And then we use some external dose response tau, because we don't really have mortality data for now, and plus other parameters that we have for now. And this is a very preliminary number, which is definitely going to change, so don't believe it too much. But anyway, this is our preliminary implication, at least for now. And because we are estimating everything at the lower bound, the health benefit already exists, the marginal cost of afforestation. Yeah. pretty much I have. And for any other relevant questions or questions I couldn't really understand, maybe let's talk later.